Does Medicare cover skilled nursing facility or skilled nursing care? The answer is sort of. Skilled nursing facilities are very different than long-term care. Medicare does not cover long-term care at all. Medicare sort of covers skilled nursing care. And what do I mean by sort of? There are rules. You might have heard that Medicare will cover your first 100 days in a skilled nursing facility. And that is technically true, but there is fine print. Why? Because the skilled nursing care, in order for Medicare to cover it, it has to be preceded by a 3-day inpatient hospital stay. So 3-day inpatient, and then Medicare can cover some of your skilled nursing facility. But this 3-day inpatient, that is where some of the fine print comes in, because it has to be inpatient hospital care, not under observation. And there is a difference. You can be in a hospital bed, hospital bracelet, hospital gown, and still be considered under observation. When you go to a hospital, then for the first 24 to 48 hours, oftentimes you are under observation, and the doctors, they're going to keep you under observation until they determine that you are probably going to be there. You're expected to be there for 2 midnights. So if you're expected to be there for 2 midnights, then they move you to inpatient hospital stay. But if they don't expect you to be there for 2 midnights, and that's a little bit arbitrary, subjective, right? That the person is thinking that you may not be there for 2 midnights, then you're under observation. So what does that mean? You could be under observation for 2 days in a facility, in the hospital for 2 days. So that's 4 days, but that's not sufficient to cover any of your skilled nursing care because you were not inpatient for 3 days. So you would have to be under observation for 2 days, inpatient 3 days, and then the other day, right? The day of discharge does not count, right? So 2 days, and then 3 days, and then the day of discharge. That's 6 days, right? And then you would be considered for skilled nursing care. So it is one of the worst things that you have to think about going into a hospital, thinking, wait, how am I being categorized? Am I being categorized under observation or inpatient? But that is why it is important that you have family, that you yourself are educated and have knowledge about this, so that way you know and you can care and defend for yourself. It is also important that you have someone that will tell you what some of these potholes are, because most of us don't know what questions to ask when it comes to our healthcare. We assume that when we have Medicare, that the stuff that we need is going to be there when we need it, but that's not necessarily the case, right? So we have to be aware of what our financial potholes are, aware of how our healthcare works, so that way during the scary time, the terrible time when we're in the hospital, that's not when we're finding out, right? We need to know ahead of time so that way we can plan. Why do they do this? I mean, typically comes down to money, right? There's different billing for inpatient versus under observation. Inpatient can have 1 deductible or 1 copay for the day versus under observation. Every diagnostic test, every surgery, every procedure can have its own copay or co-insurance. So the billing is definitely going to be more out of pocket for you as the client, the patient, than it is under inpatient. I know it sounds terrible. There is an Access to Medicare Coverage Act that has been introduced every single year since 2021 to each legislative session, trying to make it all be considered inpatient instead of under observation and making that separation. But again, you want to work with someone who is going to at least make you aware of these potholes. I think you want to work with someone that at least makes you aware of these potholes, so that way, again, you're not blindsided by it and you're not under the assumption that you're covered when you are not. It's better to know now than to have a cold shower later to learn that your stuff is not covered. So if you want to have a conversation to see what's covered, what's not, and what are the different plans that you can put into place so that way you do have peace of mind, then feel free to reach out and we can have a conversation.